here we are in the emergency department with a patient with chest pain. For those of you just joining us who don't know me, this is Dr. Mark Vaughn of the Auburn Medical Group, and you're watching our Periscope. We do a lot of Ask the Doctor type of question and answer broadcasts, and right now we have an interesting one because we have a patient in the emergency department who's being worked up. I'm not her doctor, I'm just here with her. Yes, thank you. Happy Father's Day, and hi guys. I have some regular followers. So let's turn around here and introduce the patient. This is Frida. They're looking at you and they're giving you hearts. Let me show you how they give hearts. See all those hearts there? That's because they like what's going on. So they give hearts when they see patients. Oh my goodness, they just started going again. See? Look at all those hearts.
Oh my word.
Yeah, there's a lot of people who like seeing medical stuff. So,
oh yeah.
So you're feeling better now, but the way this all started was you had awakened, and I'm doing it, instead of having you do it in your words, I'm doing it to kind of summarize it.
Yeah.
You had awakened, and were you feeling bad right when you first got up, or did it hit when you first started to get out of bed?
After I got up and was walking around.
So you got up, you were walking around, and then what was the sensation you felt?
Oh, I started getting really dizzy.
Okay, really dizzy. When you say dizzy, is that feeling lightheaded, like you're going to pass out, or is that things are spinning and I might fall over?
Spinning.
Okay, so equilibrium is gone.
Right.
And then what did you do?
I had to go back to bed.
Okay. And at the same time, were you feeling anything else?
I didn't notice it then, but when I got in bed,
Okay. We've got a chest x-ray being done here, a portable chest x-ray, which is done for workups of chest pain, which we haven't gotten to yet, but we'll talk about that. Yeah, just go ahead. She's all yours.
I'm Matt. What's your name?
Frida.
Frida. Last name?
Vaughn.
Vaughn, okay. I'm going to sit you up, Frida.
And they always confirm first and last name every time a new person comes in the room because we don't want to get the wrong procedure on the patient.
You got it. Thank you, sir.
No, I'm not running for Congress, and I have to step out too because there's radiation here, so we don't want to get that. So we'll go ahead and switch while they're doing the chest x-ray. So as you might be able to tell, this is actually my mother on Father's Day, who's the patient, and I am not the doctor in this case. I'm just answering your questions. Okay, yes, thanks for stopping by. Yes, that is my mother. And yes, ciao Italy. Thank you for joining us. Okay, so I'll give you a little bit more explanation. Hi, Holly. A little more explanation of what's going on. She called me to come over to the house, called me from church. She wasn't there. I was wondering why she wasn't. Well, it's because she was feeling sick. And it wasn't just the vertigo type symptoms. We didn't get to it yet, but she was also describing a heaviness in the lower chest, along with some shortness of breath and some sweats. And so that's why we ended up in the emergency department. Even though her vital signs were fairly okay, she was a little tachycardic, meaning her heart was racing. But this feeling of a pressure in the chest is very concerning because it can be a number of bad things, including heart attacks, blood clot to the chest, to the lungs. Can be a problem with her having a aneurysm of her aorta. It can be something less serious, like a problem with her gallbladder, or just some gastritis, inflammation of the stomach, or just heartburn. You know, a lot of things that it could be. Yes, thank you for praying for her. This is not her first time. She's had several trips to the emergency department for serious cardiovascular disease, and that's why we take this very seriously. She is on a blood thinner for a heart rhythm disturbance called atrial fibrillation. And so we take these things very seriously. Thank you. Thank you for all your nice comments. By the way, Mommy, a lot of people are here saying they hope you get better and sending blessings. And, yeah. And praying for you too. Thank you. That's very nice of you guys. You guys have any questions about the workup or how we manage a presentation of chest pain in the emergency department? Go ahead and send it in. Oh, you bet. Thanks, Holly. Appreciate that. So now that they have the chest x-ray, we'll go back to Frida. Oh, look at, she's beautiful. Keep us posted. How do you work it up? Prayers. These are different comments that people...
Beautiful, but thank you for praying.
And I'll put it back on you for a moment. So I told them essentially how we got here and all that was going on.
Yeah.
And more people saying they're praying for you.
That's great.
Yeah, yeah. Oh, one of them says, Holly says, your son is a great man. And Mason says, is she okay with you putting this on Periscope? So I should probably, on Periscope, have you give consent for all these people to be seeing you. Do we have consent?
Yes.
Okay, thank you. You're scared. She did before, by the guys.
After the fact.
I asked her before. I asked her if she was okay with it. And I'm surprised the people working in the emergency department are okay with it. This actually is not a hospital I'm affiliated with. It's one I worked at 14 years ago in this very department. But nobody here, no one here, is familiar from 14 years ago. I don't recognize one person I've seen here yet. So unless they're really listening in on the Periscope, they have no idea that I'm a doctor. I'm just the patient's son. And we'll probably just keep it that way. She is a grandma of a movie. She's lucky her son is a doctor. LOL. We have actually 50 people watching, by the way.
Oh, my.
She is beautiful. I'm glad that it amuses you. Her eye is red. Could that be connected to her chest pains? And then somebody else noticed the eye. So we're going to show them your eye. You have a subconjunctival hemorrhage in your...
Why, I bumped my head
You bumped your head?
a few days ago.
Okay.
Yeah.
And you're on the Coumadin, which is a blood thinner,
Yes.
so of course you're going to have
Yes,
easy bleeding. It's like bruising except on the eye, since
right.
the covering is clear, you can actually see the blood, whereas in the skin, you just see the purplish color.
Yeah.
And it will go through the same color patterns that a bruise does.
Yeah,
It'll
it'll turn yellow.
Yeah, it eventually turns yellow and brownish,
Yeah.
greenish before that. Oh, my father? Daddy, are you okay with me showing you? Yeah. Okay, this is my father. He's sitting over here. Go ahead and wave at everybody. And he's coming along with us on Father's Day. This has always been Father's Day. I also have 3 brothers. One of them helped get everything set up so we could come here, and then he's picking up my daughter at church to take her home, and then the other 2 sons are doing things with their families on Father's Day. Okay, be safe. Careful walking your mom around. Hi, Dad. Hello, Father. Hello from Los Angeles. Lots of hearts for you, too, by the way. Do you see all the hearts? They tap the screen to put hearts on it when they like what's going on. So we can answer other questions about the workup. Oh, hi from Arizona. Hello, Arizona. And Yo Bigley from Texas. He's also praying for you.
Thank
Showering
you.
the love. Wow, this is a real idea. Usually it's just people who want to talk about medical topics and ask me medical questions, you know,
yeah.
like we do on the radio, except to actually get listeners on this.
Oh,
Many more than we do on the radio show. So this is kind of taken over.
wow.
And I can do this at any time. Just turn it on, and the audience is there. And a lot of them are people who usually follow me. Hi from Australia, sending lots of love. Yeah, it's all over the world. But not a whole lot of medical questions, but that's okay. If they don't have any questions at the moment, we can just lots of love to us. From New York, from Uruguay. Is she taking her medications properly? That sometimes causes health issues.
Yes, I am.
Told my daughter to follow you also. Thank you. Oh, hey, you guys. There is a guy who works here who looks just like Heisenberg from Breaking Bad. I gotta show you. There he is. So totally serious. Look at him. Doesn't that look like Walter White from Breaking Bad? If I can catch him when he's walking toward us, you guys will totally think it's him. Prayers from Tulsa. That is great. Yes. Kiwi, K-I-U. I'm not sure. Ask if she knows where is Uruguay. Oh, okay. Here's your geography quiz. Where's Uruguay? Uruguay.
South America.
South America. We'll go with that. Is your mom a Breaking Bad fan?
Am I what?
A Breaking Bad fan? I don't think you
No.
watched it. It's a television show.
No.
No, and I probably wouldn't recommend it for her. I enjoy
There
it.
he is,
you know.
there he is.
Oh, there. Okay, blood machine. Oh, that blood pressure machine hurts. Your mom has a beautiful laugh. Yes, she does. Waiting for our movie, hoping everything works out well. Haha. Wait, this is your mother?
Can you document that? Okay, do that, and then when you get the chance, just go ahead and use it.
Totally. He totally looks like him. Everybody thinks he looks like Walter White or
Heisenberg to break
Oh,
it
I
down.
love that.
Doesn't
yeah.
he look like him?
Yeah, he does. I love that. I never really thought of that. I watched that show originally when it first came out, and I couldn't wait week to week to see the next episode.
We're doing a Periscope here, but we won't put you in it if you don't want to be in it. We're just talking. There's lots of people around the world who are giving hearts to. Here, I'll show you. This is how many people are watching, and this is people giving hearts as they're happy about what we're showing.
Oh, is that right?
And they are wishing her well, and we're just talking about.
Yeah, a lot of prayers and support. Huh?
Yeah.
Don't
Yeah.
ya? How good is that?
How's she related to? She's my mother, and I'm happy she's in good spirits, keeps us updated, which is her hobby. And hello, Chris. They're saying hello to each other now.
Okay.
Oh, again, somebody didn't catch before when you gave consent, and they're asking if you're okay with this. And yes,
Yes.
she gave consent on camera earlier. Beautiful hair. Son didn't inherit.
There.
They're saying I didn't inherit your hair because they know I'm bald.
Okay, Mrs. Vaughn, I'm going to give you some fluids and some diltiazem. It's for your heart rhythm, trying to get it, under control.
Okay.
Diltiazem being a beta blocker can slow down the heart, and we use it a lot of times in fast heart rhythms, both atrial fibrillation and other rhythms in their sinus, because it helps to slow down conduction through the electrical tissues in the heart.
You must be a doctor, huh? Okay. You sound a lot better than I could.
I think that's a nurse there. He's about to give diltiazem. Brand names would be things like Cardizem. Diltiazem is a calcium channel blocker. Yes, that's correct. Hippo is okay as long as she gives her consent, guys. That is wonderful. What is the average heart rate? For a woman in her 70s, I'd say average heart rate would probably be expected to be actually in the 60s to 80s, roughly. And
Never gets that high.
her heart rate is 108. Her blood pressure is not up there. So it's heart rate, oxygen saturation, and respiratory rate that you see up there now. And so she's a little bit fast, and that may be part of why she's feeling the chest pressure. So getting the heart rhythm, heart rate at a normal rate may help a little bit to make you feel a little better. And if it does, we get to go home.
Oh, good.
Yeah, that'd be good.
And where is your IV, might I ask? Right over there.
She's so beautiful.
Go.
Gotta go shower. Much love. Keep me posted, please. That's Holly.
Oh.
Not our Holly.
Oh, not your
No,
home.
another Holly that likes. Bye, Holly. Somebody's saying bye to Holly. And they are showering you with hearts. Other medicines that could be used is, mom doesn't need all the excitement, perhaps rest. Oh. They're probably right.
Wow.
Except
Yeah.
you seem to be amused by it. So.
Rest is always good. I feel like I get less rest the older I get. Right?
Well, that's not good.
Well,
Okay.
kids keep me busy.
Yeah, we do.
Yeah, how many kids you have?
4. My youngest is 8. Just sent her to summer camp.
Yeah. I had 4 too. 4 also.
So did I.
Is this your baby?
Yes.
How'd you
No,
know?
I was just guessing.
It could have been any of us. She doesn't look that excitable. Hello. I pray you feel more comfortable soon.
What's your practice?
Family medicine in Auburn.
A doctor.
Auburn Medical Group, yeah. I was do family medicine, but I was board certified in emergency medicine.
How are you? Okay, you started out that way?
Yeah, keep up my certification. Actually worked in this department from 99 to 2001.
Okay.
But I don't recognize one person here.
Probably. Well, I was in Hayward before I came here. I've been out here 5 years. And, yeah, I've been with Kaiser for about 10 years now. So,
Okay, so right after I left.
mm-hmm.
Yeah, back then, I don't know if it's the same way now, but back then, we would cover the Morse Avenue department and this department.
Yeah, now we're separate from them.
Oh, man, I was wanting that so much. I was.
Yeah, that just happened a couple of years ago, so they have their own.
Okay, now they're all kind of doing it for me. People are asking questions, and other people that heard the answers earlier are answering the questions, so
Okay.
I can have a conversation with you guys. And Danielle's saying it's his mom. Okay. Okay, thank you. I hope she feels better. I hope she recovers soon.